Why does your back hurt and your hips? Well, why does most things hurt after you've had the baby? Shouldn't it feel better? Let's talk a little bit about that. Hi, I'm Dr. Ken from Spinal and Sports Care Clinic, and today we're going to talk briefly about postpartum back and hip pain. This is something that comes as a shock to some gals after they've had the baby, especially if this is first time. They've had the back pain during pregnancy. They expected that. People know about back pain during pregnancy. But now it's been 3 months and the back still hurts and the hips still hurt. And this is usually where people end up at their OB or their primary and saying, why? Why does it still hurt? Let me tell you some common reasons for that. So let's start off with the most common reason, which is that this pelvis is still loosey-goosey. What do I mean by that? Well, when you're pregnant, as you probably read, there is a hormone floating around called relaxin, and that hormone does exactly what it sounds like. It relaxes things. It relaxes the pelvic ligaments that go across here and here, relaxes the ligaments in the front, and basically allows the pelvic bowl to move and expand to allow the baby to safely pass out through the birth canal. There's other hormones as well that are also acting on the ligamentous tissue. I think progesterone is one of those as well. I'm not entirely sure. I haven't read up on that for a while. But regardless of which hormone it is, these get soft and they get very flexible. And the pelvis, as a result, starts to move quite a bit. One of the main reasons that we have pain postpartum is that flexibility persists. And the joint actually can become a little unstable. And especially since you're picking up baby, you're holding baby, you're carrying the car seat and that 40-pound diaper bag, with everything in it, and the back just gets cranky. And so usually there's a couple things that we want to do for that, and we'll get into that in the video in a couple minutes here. The other thing that can cause a lot of problems are the hips. So when you spend 9 months or so laying on your side, the tendons, which insert right here into the joint, hopefully you can see that, they get a little cranky. And the muscle, the glute, which is right here, also gets a little cranky. So one of the things I often see when I check and I palpate the muscles is I see big trigger points in the glute muscles. And they're usually quite painful, and that's another big problem. And the final thing is a lot of times the lumbar joints here, this is just the sacrum. I don't have the lumbar vertebra above it, but these are the lowest joints where the sacrum and the lumbar vertebra join. The joints of the low back can get really, really irritated as well. Partially from the lumbar curve increasing during pregnancy, the weight of the baby kind of dragging things forward, okay? And sometimes that irritation can persist. And again, even those joints are a little bit loosey-goosey as well from all that mobility that was gained by those hormones. So that's usually the number one problem that's going on. Sometimes the tendons in the hip can get even worse, and they can actually start to degenerate a little bit, and we call that tendinosis. It has to be there for quite a bit of time for that to occur. A lot of times I think it's tendinitis, or sometimes what we call tendinopathy. But I have seen postpartum gals, especially ones who are on their second, third, or fourth child, where their hips can be pretty bad. That usually takes a little bit more effort and work to get better, but there are things that we can do for that. In general, to fix this sort of problem, we basically need to do a couple things. One, we need to calm everything down. So muscle releases to the hips, light adjusting to the hips, and trigger point work to the glutes. Maybe some light adjusting to the SI joints, the sacroiliac joints, the pelvic joints. However, we want to go careful on how much we adjust those pelvic joints, because don't forget, they're loose. So a lot of what we do as well is strengthening. So we retrain you maybe to move a little bit better during home stuff. Maybe we talk about sleep, but we also give some simple home care, start strengthening that pelvis, start strengthening the core musculature again, so that it supports the pelvis better. And this is really important as well for gals who are planning to have a couple more kids, because if you're going to get pregnant again, you really don't want things to be really, really, really loose. And so that's usually our approach, and we found it works pretty darn well. It does take some time because muscles take a little bit of time to get stronger. Ligaments take a little bit of time to tighten up, but with persistence and hard work, they usually do just fine. So I hope that helps, and I hope that's a good explanation for why your back might still hurt, even though you had that baby 3 or 4 months ago.